If you're recovering from a running injury and you're trying to reintroduce speed back into your training, make sure you watch this video to learn 2 different techniques for reintroducing speed back into your training. This video was inspired by a patient of mine that I've been working with for the past few weeks who suffered a hamstring strain while he was building up for a half marathon. He was on the 11th mile of a long run and he strained his hamstring. If I remember correctly, there was some element of speed that he was introducing into that long run. And now as he's building back his mileage from his initial strain, he is trying to reintroduce speed back into his programming. And this video was inspired by him, and these were kind of the 2 things that I talked to him about. Hi, my name is Dr. Michael. I'm a physical therapist here in Evanston, Illinois with Valiant Physical Therapy, where we specialize in working with runners. And reintroducing speed after an injury is a common desire that a lot of runners will have after an injury, because running fast is more fun than running slow. So, and oftentimes speed work can be something that irritates an injured area more than just base mileage. So once your base mileage is regained, the idea of, okay, well, how do I add in speed work becomes a very relevant question that a lot of people want to know the answer to. So I have 2 different approaches, and they're not exactly different in isolation, but 2 different ideas for reintroducing speed work back into someone's training. So once the base mileage has been built, they're not struggling with any discomfort with their normal conversational easy runs, then one of the first things I'll tell people is you are going to want to practice negative splitting your runs. So this may be a little anticlimactic for those of you who know what negative splitting is, but if you don't know what negative splitting is, it basically means that as you go through your run, you are progressively getting faster. So your splits for each mile of the run are getting faster and faster. So there is some degree of a negative to your splits as you're doing the run. So again, this is a little bit anticlimactic for those of you who are very familiar with this concept, but it is a very easy way to add some degree of pace changes and some speed elements to your run if what you've already been doing or what you've already established is the base, consistent, conversational paced runs. So with negative splitting, what it then encourages you to do is to push the pace and to increase your pace throughout your run. So you get the benefit of having already warmed up the tissue that maybe was injured with the first few miles of the run, and then you progressively get faster as you're going throughout the run. So it's not exactly a super aggressive way to add speed, but it is a very light way to say, hey, can this tissue handle faster running paces, faster than conversational pace? And it also starts to work a lot on the skill of running, which is pace control and trying to, be strategic with what paces you're trying to hit during the run, and then focusing on trying to get faster over time. Okay, so negative splitting is a really simple way to begin to add some speed after an injury. But the second version is a little bit more, I think, what a lot of people who are going to be watching this video are interested in hearing, which is things that involve actual intensity. Okay, so the second thing is to introduce strides. And basically what a stride is it's 15 to 30 seconds of an intense effort, okay? This doesn't mean a sprint. This doesn't mean, flat out running. It just means 15 to 30 seconds of some degree of a much faster pace than you would be able to hold for any, distance per se. So 2 to 6 reps of the 15 to 30 second strides is also a really nice way to go. So obviously the easiest thing to do would be to do 2 reps of 15-second strides. And then over the course of time, you can either increase the time of the strides or add reps. So here's why I really like the strides, okay? It is a very short amount of time, and it is based on time. With a lot of running workouts, they can oftentimes be based on distances, and that's fine for training once you are already established. But when you're coming out of an injury, time and duration is often a more important variable to control for rather than distance, because everybody's running at different speeds and everyone's kind of training for different distances. And saying something like, hey, let me do a 400-meter effort or an 800-meter effort or even a mile effort, you just kind of commit yourself to running for an extended period of time when we're not actually sure how the injured area will handle any amount of intensity for any duration of time. So strides are really short, and you can kind of control the intensity as well as picking the number of reps that is manageable for you in this situation. So strides are really nice to add at the end of a run. So let's say you go for a 3 to 4 mile run and then you do 2 20-second strides at the end of it, or 4 20-second strides at the end of it. And you basically just see how that feels, and you can modulate the intensity according to what your leg can handle or your injured area can handle. So let me go to the example of the patient that I was referencing earlier who has a hamstring strain, and his base mileage is already built and he is reintroducing speed and he's doing the strides. So I told him to start with doing 4 strides at 15 seconds apiece, or maybe it was 5 strides at 15 seconds apiece. So a handful of reps, but not that long of time. And after the session that I had with him, he sent me a message back and he was saying, hey, I can kind of feel some sensations in that injured area. It's not really painful, but I can feel some sensations in there when I'm doing the strides. So and then my recommendation to him was to actually lower the intensity, to keep the same number of reps and duration, but to lower the intensity that he was running so that he can handle it maybe a little bit better. But being able to test the waters with just a few seconds of intensity and doing it repetitiously is a really nice way to know, like, hey, where are the limits of this injured area without overdoing it or overcommitting yourself to a workout that maybe is too much. So even though this gentleman that I'm speaking of felt something in his hamstring, it's not like he retore it and he re-injured it and now we have to start over from square one. He was able to do some intense efforts, and yes, he felt it a little bit, but it's not really that concerning. And we are then able to throttle back a little bit and say, okay, let's decrease the intensity of those strides a little bit, run a little bit slower, but I still want you to keep attempting it so that the injured area can learn how to handle that intensity. Because no amount of more running at a conversational pace will prepare the tissue for that intensity. You have to reintroduce it gradually, and this is a really, really nice way to do that. If you found this video helpful, make sure you give it a like, and if you know somebody that's trying to reintroduce speed after a running injury, make sure you send it off to them. Thanks for watching.